to show our new site, DrugCocktails.ca. So we're going to do opposite. We like it when you are looking at your phone during this conversation, and pull up your phone, your smartphone, your tablets, and save this URL to your desktop. And Dean.
So we have no disclosures just to get started. And
so we know many celebrities have died after combining medications with substance abuse, such as Corey Monteith, which is this generation. My generation was Heath Ledger. The generation before that was Nicole Smith. Like, these are celebrities that have passed away from mixing substances with prescription medication. While we're fascinated with celebrities, many more average citizens and you suffer harm due to adverse reactions from prescription medication and substance cocktails. So this could be intentionally and unintentionally done. So youth with chronic illnesses are as more likely to use substances than those in good health. This is from the BC Mercury report for adolescent survey. I don't know if you're familiar with that survey. So when we talk about chronic health illnesses, we're talking about oncology patients, diabetic patients, and even who are higher risk are patients with mental health concerns such as depression.
Transplant patients and
asthma,
many chronic health conditions.
So, and these questions come up all the time with Dean and myself, and I'm pretty sure with you too, that, well, I'm smoking pot. Can I smoke pot with this medication? So how do you answer that? And it comes up, I don't know if you guys ever had that before in practice? Yes, you have to? Yeah. So how do you answer that? We want to be a harm reduction approach, and that's really huge in mental health, right? It works. Look at drinking and driving. Harm reduction works. It's not just the BC ministry mandate, it's also even Vancouver's mandate. And we practice it all the time. So we're going to go on to a case study.
Yeah, so we'll start with the case of JF. So she's a 20-year-old female, formerly dependent on using heroin, now taking methadone as replacement maintenance therapy, and she also admits to ongoing marijuana use. Gets admitted to the hospital with a diagnosis of psychosis and is treated with quetiapine or Seroquel, which is an antipsychotic drug. And as is typical, during discharge counseling, when we go to see her before she leaves the hospital, she asks, with this new medication, are there any problems when I take it together with methadone or marijuana? So like Sabrina said, where would you look?
So we're actually, before we even look, where have you guys looked in the past? I mean, no? Okay.
So you could look in the big blue drug book, the CPS, that's the Pharmacist and Physician's Drug Bible. You'll find methadone in there because it is a prescription medication, but what about cannabis? Generally not in there. There's some synthetic oral forms, but not the smoke form. You could do a PubMed search, go to the medical literature, start looking through journals on addiction, trying to find information about that particular substance medication combination. But it's very time consuming to do so, and not all of the information is in the primary literature. Sometimes the interactions are theoretical based on the pharmacology rather than an actual documented interaction occurring.
And Dean was saying it takes time. When you have the youth in your office, you want to give them a response right away because you want them to keep their interest.
You may have run across the vaults of Arrowhead, arrowhead.org. Has anybody seen that website by show of hands? Very interesting website. I find information there tends to have a bias towards promoting substance use. So if you're looking to grow bigger pot plants, maybe a good brownie recipe, that might be the place to go. You will find some lived experience, but it's kind of haphazard. You don't find a consistent presentation of, a systematic presentation of the different substance medication interactions. So, enter Drug Cocktails. DrugCocktails.ca is a brand new, first of its kind website in the world that helps youth get the facts about the risks of mixing medicine, booze, drugs. And so we'll take you through some screenshots just to show how the site will operate, and we have the live site available as well if you want to do some searches afterwards. So we're going to go to the website and enter in the medication name, quetiapine or Seroquel, either brand name or trade name will work. And this is what you're presented with. This is the screen after you do the search for quetiapine. And there's a listing, you see 4 substance categories in this screenshot. There are 10 substance categories in the website in all. So alcohol, tobacco, caffeine, cannabis, we cover opioids, stimulants, ketamine, benzodiazepines, a whole bunch of different substance categories. And you can see there's some warning icons there, so we'll step you through what those mean. But let's first take a look at JF's query. What about quetiapine and methadone? Well, there's 2 serious risks with that. In general, opioids and quetiapine can both cause sleepiness, dizziness, and confusion. And opioids can make this worse, and it can make it more dangerous to drive or do activities that require alertness and attention. The second one is a very specific problem with methadone and quetiapine used together. Both of them can cause an abnormal heart rhythm, and mixing the two could make the chance of having a deadly abnormal heartbeat more likely. So the cocktail should likely be avoided. As far as cannabis and quetiapine, much like methadone, additive sleepiness, dizziness, and drowsiness with that combination. Okay, so those are the 2 warnings specific to her query.
And we also want to make a note, we also have, you can see the lay terms that were advised from the youth, and some, it was from a previous book.
So BC Bud, 420, ganja, you know, the list goes on.
Yeah.
Right? Many different substance nicknames that are changing.
I use this list because sometimes the youth will say something and I don't know which category it is, so I know I myself can come up with that.
Now, there's a youth version of the DrugCocktails.ca website, and there's a pro version as well. Let me show you the differences. So we had the lay information in our previous publication, our cocktails book, which we've translated to the site, but there's a pro site now. We had all this information kind of in a filing cabinet on different Word documents, all the detail in the background of the research that was done to produce the website, but it wasn't really available to clinicians previously. So they look at the warning and they go, gee, I wonder what they mean by that warning, like what's behind that? And so the pro site addresses that. Let's do that same query for quetiapine in the pro site. And you can see, just looking at it, there's more detail, right? Much more information. So specific to methadone and quetiapine, 14 patients who had been receiving methadone for 1 month were given quetiapine for 30 days. Concomitant use resulted in an average 21% increase in plasma level. It changed the ratio of R-methadone to S-methadone, and it also resulted in prolongation of the QTC interval on the electrocardiogram. Okay, so that's the medical detail behind those warnings for the same query we just showed you.
And this is great for that youth that you do have in your clinic that or outsmarts you, but I like to call it smart ass youth, who has like their sciences and neurology sciences and all that. So it's great that you could, use that in children's research if it gets to that point. Yeah.
And it's a very transparent site in that all of the information on DrugCocktails.ca is fully referenced back to the medical literature. Anywhere on the pro site you see something that says PubMed citation, that's a hyperlink. You click on that and you go right to the PubMed abstract for that article. If you have full text access, you can get that paper pertinent to that particular interaction right. So very, very transparent, and like I said, for people that want the extra detail, it's available to them. Now, we talked just about printing of information a few moments ago. We decided to give the option to print this information while it is readily available online with no barriers. Some people do still like printed information in hand. So from the professional site, you can print a version of the youth warnings or the professional warnings. From the youth site, you only get the lay language warnings. Here's what they come out looking like. It covers the medication in all 10 substance categories. The warning text and the warning icons are printed intact. Tends to be about 3 to 4 pages for the youth lay language warnings, about 6 pages for the pro site, just because of the additional level of extra detail. Kind of useful. You could see that if you kept a paper chart for that youth, you could put a copy of that interaction with the medication they're taking. So it's very handy for anybody.
Yeah, especially when there's a lot of turnover of staff and transition of staff. Like it's something that is in their chart they review and follow up on. And as a paperless, what we've been doing in our clinic lately is taking screenshots of info they need to keep up with, and they just have screenshots and have it on their phone, so it's a little bit custom.
And there's the pro printout, as you can see again, an additional level of detail. Now, DrugCocktails.ca is not just medication interactions, there's also general substance information included in the website, and that's courtesy of another PHSA organization, heretohelp.bc.ca. We're so happy to be able to partner with them on that. We thank Connie Caniglio, who helped broker that deal yesterday. She was presenting yesterday. We don't have to reinvent the wheel to keep up with the substance information. They update it on a regular basis, and they allow us to excerpt the substance-specific information for our website. So on the substance info page, we're going to have information about what is the substance, some pictures of what it may look like, there's many different forms, of course. How does it work, and what are the health risks of taking that substance by itself, never mind in combination with a prescription medication, which the interaction part of the site addresses.
I feel like a lot of the healthcare professionals are using this site. This side right here actually would learn more about the substances. Something we get very little in nursing school.
Right, and the substances, we talked to a narcotics officer from Burnaby RCMP, said when you think you know what's going on out there, it changes from month to month to month. new nicknames, new variations of different stimulants, especially right now are popular. New things seem to come on the market, so to speak, all the time.
So we all know like successful projects that are aimed for youth are developed by youth. And so it was really important to have the Youth Advisory Council involved. This is the Children's Youth Advisory Council. So they gave amazing feedback from our original database website. So things that they wanted was they wanted to have a visual pleasing. As you can see, the youth pages is a little bit more youth with the sketching, scrabble paper compared to the healthcare professional site, the graphic paper, a little bit more cleaner printing. They want it to work on all smartphones, so all devices. So in touch with that part of that, they want it to be touch friendly. Although this is not an app, but they want it to be touch friendly for the devices. Plain language warnings, they got that. Keep it simple. And there was a really cool, I don't know if you could go show them, but this suggestion one of the youths made is a hide button. So at the corner of the website, you see this hide this site. So that's, you just press it takes you straight to Google. So if you're with your friends, you don't want your friends to see what you're looking at, especially your parents.
Or your parents.
Yeah, they're walking by, and it takes you straight to Google. So that's very youth-friendly, very smart thinking I got from the advisory. And hide this indication and purpose. So if you look at a medication, they wanted to know what the medication was for. For instance, they were an antipsychotic versus an antifungal. So in case they typed it wrong, but mind you, typing is really smart. Yeah, but they wanted to have that plus and hide. They wanted it, but they also wanted to double check if they had the right medication. So that's another feedback. And making it way more youth-friendly, no personal information is collected on the youth side of the site. So we don't have any identification, like who was the youth, where did they use it, the computer from, all that. So this is how we try to create that youth-friendly feel.
And like you mentioned about removing barriers, there is no barrier to start using the website. They don't have to register. They can come in and start typing the name of their medication right away.
Except agree to terms.
They agree to terms, but there's no sign-up registration. And that also prevents us from collecting personal information.
Mm-hmm.
So like I said, keep it simple, right? So we wanted to do that. We had the harm reduction approach, which was inherent in the youth-friendly handbook.
Yeah, this is the original book.
How many of you have seen the original handbook before now? No, Jane has. So we had a guide to go by. So our predecessors, Kathleen Collin and Mary Fiona from the Youth Health Clinic, had developed this book in 2002, and they got the language level like exactly right. And I wanted to keep that intact, keep it simple,